Mr Michael Copeland to wind on the amendment. Mr Copeland.
Thank you very much, Mr Principal Deputy Speaker, and I do rise to speak on the amendment. I must say, having learnt three things, the first one is that the members of this chamber can talk faster than I can write. The second one is you should always have a pen that can outlast the duration of the time that members in this chamber can speak for. And the third one is worrying doesn't really get you anywhere, because the Minister has just, in his summing up, referred to most of the things that I wanted to say that other members had said. This is an important issue, and we need to look at why things have changed and why this service has become necessary and why this service needs further support. And things change generally because of changed circumstances. The way our society was structured in terms of the services that this service provides, shopping or personal business, local health services, local pharmacy, post office or banking, training and employment, or visiting family and friends. Laudable things that used to be available because of the way we lived, where there was a shop somewhere near where you lived that you could walk to, that would hold in stock the goods that you needed, where you could buy them and get them home reasonably simply. The issue now is that everything is centralised, be it medical services, or health services, or shopping, or banking, or the whole range of other things that people used to do by necessity, but that which were accompanied by social interchange and the notion that they were not alone, have gone. Mr Beggs referred to the fact that to get from Larne to Antrim Area Hospital for a 10 o'clock hospital appointment would take 3.5 hours there and 3.5 hours back. Now, presumably this is not by a young person or somebody possessed of great physical strength, but of somebody who needs to get to the hospital because they haven't got a car, they haven't got someone to take them, or they are in some way infirm. That, in this part of the United Kingdom, seems to be an astonishingly long time to access a basic service upon which your physical well-being can be dependent. We here, once again, have a chance to do something which is right, but something that will necessitate effort being made not just by one minister, but by many ministers. The siloing, to some respects, of money. And in government, as in life, you can pretty do much anything you want if you've got sufficient money. There was someone who, Ian McRae, during his, and he spoke very well, he hoped that the message would get across to the Minister about the funding. And the Minister looked as if he really hoped that the funding would follow the good wishes that Ian had given to him. Because no one in their right mind would actually stop or try to prevent the notion that people who are in need are facilitated. This particular service offers value for money. It offers human contact to those of our citizens who in some circumstances now are bereft of human contact. And it does bring forward the notion that we as a society can do things for each other. And because local people are providing a local service for local needs, it will, in my view, be done less expensively, more humanely and better. The issue between the amendment and the proposal is again a matter of some interest. Never did I think I would stand in this chamber to acknowledge the fact or state the fact that Sinn Féin on this occasion on the matter of social welfare or social importance had not gone far enough. They did limit their delivery largely to the health service, although there were some interesting ones, because I'm not sure if it was a slip of the tongue. I did pick up somewhere that Sean Lynch, when he spoke, had asked the House to support the amended motion. I do believe that was possibly a slip of the tongue, but the truth is, I believe, and we believe, that the amended motion goes further. It gives us a chance to seek a solution. It gives us a chance to seek a solution for once and for all. And it will be dependent not only on the Minister of Regional Development, but on all the other ministries who have an input or who can take funding. We have saved... I will, Frahia.
I would accept that and understand that and saying that. But if you look at the history and tradition, especially in this place here, neighbourhood renewal is a classic of it. We've been saying that we get all the ministers together, all the departments together, and let's work out how you can move a thing forward. You know, what I had said earlier on in my intervention was that the motion is specific to health issues, and it's to try to ensure that people don't fall through the cracks. What you're talking about, we could be sitting here in a new mandate and the next mandate talking about it because there's no push on it, and we're being very specific in what we're arguing for here.
Next minute.
I thank the member for those comments that took about 23 seconds and the extra minute that I gained from it. Look, the truth is, as the Minister has said, there are elements, the most serious elements within the health service are already a statutory provision for the Department of Health. And whilst we can tackle papering the cracks, or, as you have referred to, I believe that we should take the opportunity to address this issue holistically and once and for all to settle the notion that we can provide this service more effectively, more properly, for the benefit of the people.
Call Mr. Cahill to wind on.